You can hit the screen with your finger.
Oh.
Yeah.
Are we? Oh, I was gonna say.
I did hit, okay. Okay.
Yep.
Might be.
All right, at this time, we'll call this meeting to order. Roll call, everyone is here. Next, we'll go to the approval of the agenda. Do I have a motion? Jeff, a second. Virginia? All in favor, say aye.
Aye.
Oppose? Any questions? Then we'll go to the approval of the April minutes. Do I have a motion for a first? Julie, a second by Milton.
Thank you.
All in favor, say aye.
Aye.
Oppose? Any questions, anything? Then we'll go to citizen input. Is there anything? No. And then we'll move on to Cindy, COVID update.
Okay, so just giving you a picture of where we're at currently this month. As of Friday, we were at 2,638 positives total in the course of the pandemic. We had 18 active cases. However, that has gone up fairly significantly over the weekend. So we're seeing some issues through certain parts of our county right now. We still remain at 35 deaths and have only one hospitalized that I'm aware of at this point. Our biggest rise in cases has been seen in the age group under 18 or 18 and under. So we have seen some school situations that have led to an outbreak in our largest district. And so we have been working through that current situation with them right now. As far as vaccination, total first doses given through our department was 3,611 and second doses 3,178 for a total of 6,789 doses given from the local health department. Overall, right now, vaccination rates in the state are a little bit down from where we were hoping to be at this point. So Wisconsin as a whole is at 44.4%. Kewaunee County, we fall at 37.3% vaccinated. Within that, we have 7,614 people that have received at least one dose, 6,954 that have completed their series and are considered to be totally vaccinated. Any questions? Yeah, Jenny.
Yeah, the question that I have is, we don't get any information about the VA. Jeff and I were just talking about that. Like, brought my father down to the VA to get his shot. And when I was there, they asked me to have mine done while I was there. They asked my sister to have it. All these people that are getting it from Kewaunee County, even if we can't get the names, can't we get a tally of, say, how many residents of Kewaunee County?
This
you
is
have
it.
that?
This is it. That's what I just read you. So we
Oh.
are at 37%, 37.7 or 37.3. So 7,614 shots have been given total. So people are going outside of the area
Okay.
and they do get counted in that count. It's not just what we give here.
Okay.
We're the main vaccinator within our
Okay.
county. Hometown Pharmacy, it's Algoma and Kewaunee are doing it together. So Hometown Pharmacy is
Okay.
another entity, but
Okay.
all of those people that go to GB, to the VA, to
Okay.
Lambeau, to wherever they choose to go are counted
Okay.
in this
Okay.
count.
I understood last month that you said the VA wasn't sharing the information about who was.
No, I'm not certain of that. My
Okay.
understanding of the situation is that if you choose to be a state vaccinator, it's mandatory that you put your data into their system within 24 hours. Some places have been lacking a little bit on that 24-hour
Okay.
rule, so sometimes this might not be perfectly up to date. But Walgreens, CVS, the VA, all those places, if
Okay.
they signed up to be a CDC vaccinator, they are required to follow that stipulation.
So those vaccinators, regardless of where they're located, would be reporting back to the home county? Like, let's
They would
say
be
I got
reporting-
vaccinated out of state.
Yep, that's questionable. How it works is Wisconsin-based vaccinators report into the Wisconsin Immunization Registry.
Okay.
And therefore, that's where our tallies come from. So out of state, I'm not quite sure.
That'd be a pretty small number, I would imagine.
Correct.
So our numbers are pretty solid where
Correct.
we're at.
Yes. Any other questions right now on COVID?
Cindy, what's going on in the LC school district?
Yeah, I assume that someone would ask me that. It's Luxembourg Casco experienced a significant outbreak within their high school following a parent-sponsored prom for the junior and senior class. So what defines an outbreak is 2 or more cases within one building that are connected. Our numbers got up to about 16 to 19 at one point of positives just within that building. The last numbers I read, and I apologize because I can actually pull this up for you, but they're well above that now. They, as of last week, Wednesday, had 73 students and 2 staff affected by that outbreak. Now, that was not all positives, but that was positives and their close contacts. And we saw significant spread within the building. So it was traced down that, yes, 7 cases originated probably from the prom, but then 25 were from the spread within the building. 3 were from the track team. You know, it went down to different entities and where we were seeing that spread.
Are those all actual positive tests or are those probables? Because some of these things are all termed differently and it's not actually
So
infection.
we had about 16 positives in the building and the rest were close contacts. Okay. Out of those close contacts, several though were symptomatic, which actually makes them probable cases. Okay. So last week, Monday, we made the district aware of the whole situation. We've been working very closely with the district nurses to help do the contact tracing. We had special staff that was just assigned to Luxembourg Casco to help them work through it because it's complicated when you're in a school setting and they're going from room to room and who's been in contact with who. They felt strongly that that should be brought to their board. So the board is aware of the current outbreak. We brought that to the board on Wednesday and the board decided to, instead of take action to help control that outbreak within their building, to eliminate all COVID measures and return to pre-COVID things, 100%. There was very little, if any, discussion on what that meant that night by that board. The next day, they found out that by doing that, not only did it eliminate masking, which has been the focus of a lot of this is, getting rid of masking, but it did a lot more than that. It took down all of their barriers within the school. So all plexiglass barriers, and they did an outstanding job. Every single student was behind plexiglass. So all barriers were to be removed. No further virtual learning would be allowed throughout the building. And then it highly changed how the WIAA looked at them. And so if it eliminated their quarantine also. So they continued to isolate their positive cases. Okay, there's a difference. If you're a positive case, we isolate you. If you're a close contact, you're served a quarantine. They eliminated all quarantine. So all close contacts, the 70 plus that there were going on in the district, were allowed to return to the building on Friday. And in doing so, WIAA play for other schools was affected because those schools no longer wanted to take the chance to bring that into their district or to come to our district where there was an outbreak. And if a child does not step down, so say you're a close contact and you're at school and you want to be, let's use the baseball team, so you're going to play baseball. If you don't step down, that disqualifies the entire team from play. So it has escalated to a little bit more of a hostile sort of situation over there. And we as a health department haven't changed our stance on anything. So what I told them was we will continue to do our job to the best of our ability according to state statute. We will continue to isolate positive cases, and we will continue to contact close contacts and let them know that they should be quarantining. So whether the district decides to allow them in their building or not, that's policy set on their level, not on ours. That's where we're at. Tonight, they will be holding another special meeting at 7 to rethink that a bit, because I don't think that they understood the depth of their action taken on Wednesday night.
What's been the parents' response generally?
So there are two very distinct groups. There is a strong group that believes that this was a great decision and that we should get rid of COVID. They're tired of COVID. They don't want a mask. They don't want to have rules anymore, recommendations. There is also a very strong group that is terrified for the safety of some of those kids. So the ones that I heard from following that meeting were parents with special needs children who are like, so now my child who has a congenital heart issue and has been through dozens of surgeries and cannot really learn well in a virtual environment, but keep in mind that that virtual environment is now gone, right? Because that was taken away. They have to make the choice. Do they continue out that school year and allow them to complete it and move on to the next grade, or do they keep them at home? Because in the environment that they're at right now, with no virtual learning available, those kids are up for truancy issues if that continues.
I know it's up to the school board to decide what they want to do, but would a recommendation possibly be special needs in general could mean something as simple as, I'm afraid of the virus and I don't want to be without my plexiglass on my desk. So could they not accommodate that child and put them not in the corner necessarily, but, distanced in plexiglass if they choose that? I mean, that's a board decision, obviously, but.
And they have the right to do that choice. From our standpoint, it gets complicated because as a health department, we don't go by where the property ends. So for instance, they have an open lunch hour, an open campus. So their kids that are close contacts can be in school according to where they're at right now, but they can't step off that curb without being a close contact and not be allowed into the neighboring businesses, the areas that are serving lunch to the kids. It's very complicated. It's the same with those schools in sports. they don't want close contacts coming in and risking having that spread through their building. So where do you start and where do you stop with measures that say, well, I think their point in trying to do this was it's freedom of choice. Everyone has a choice. If you want to wear your mask, wear your mask. If you don't. But it got more complicated than that. And they've also really developed a hostile environment in that regard, where now we've gotten dozens of calls from parents who feel their children are being bullied because they have a mask on. So they don't feel safe in the school setting. It's
not going to end anytime soon.
no. And so I don't know if you saw my statement on Thursday, but I said it was an unfortunate decision. It wasn't well thought out, and they didn't look at the consequences of it. And I think that they would very much like the health department to step in and say, no, we're in full control, and we're going to take over. And that's not how it goes, because their board does set policy within their jurisdiction, just like you set policy here. So, what I've put out there is that we will continue to do our job to the best of our ability, and our recommendations really have not changed.
They got some decisions.
They do have some decisions to make this evening. Any other questions? Well, so that same meeting altered some of that as well. The first decision that they made was to go pre-COVID. The second one was to shorten their school calendar. However, they shortened the primary, the intermediate, and the middle school to the Friday prior to Memorial Day. But the high school, keep in mind that's where their outbreak is, they left with the original calendar and will serve the full year. Basically, what they need to do is they need to ride it out 3 weeks, if they can do that. So as far as our other schools, they're doing fine. Kewaunee chose to have a special meeting as well a few weeks ago. They got rid of masking outside. So during recess and things like that, the kids get a mask break, but in the buildings, they continue to mask at this time. Algoma has not changed their rules and regulations at all.
Is WIAA athletics requiring masking during your competition?
It is highly recommended. So I don't know that they necessarily wear masks.
Yeah, WIA does. But if they go to other functions, then it's so far, like my daughter plays outside WIA, and then they don't. It's if you want to, you can, but there is a difference. I can tell. Like, I'm just saying, when they're running on the court, like when she's wearing the mask, you can tell she's very, very tired. When she's not wearing the mask, there's a difference. And it is hard on their bodies because she's like, I can't get the air, Mom, when I'm running up and down the court. So on WIA, when they are school funded, so far, anything school funded WIA has to wear a mask, unless I think softball, they don't, because it's outside, and track,
Outside.
They don't.
Correct. When competing.
Yeah.
I think what I have understood about what the schools are facing is that if you choose to compete in a WIAA sport right now, you had to formulate an agreement with the schools in and around you. And then you had to meet how many parents or spectators were going to be allowed at it, whether masking was going to take place. There was a whole list of stipulations. And if you broke those, then the other teams would not come to your facility.
But I think, don't you think some schools have different rules from other schools in WIA?
I can't answer on that because I'm not.
Because I think as a school, they can implement something. So WIA puts their rules out, and then each school can implement. So an example is at a baseball game, Kewaunee wants the parents to wear the mask outside, but if they go to Southern Door, they don't have to wear the mask outside, the parents. So it's what rules the school implements off of WIA, I believe. Some are stronger than others.
Any other questions? All right.
Okay, Cindy, we will move to the annual report.
All right. So each year I put together a full annual report for the Board of Health. This is a requirement according to state statute for each local health department, and it is typically due by April 1st. However, we were allowed to extend that to May 1st. So the report did go to the state and met that deadline, and then I would like to just share it with you. So if you turn to page 4, there's a quick synopsis of what 2020 looked like within the health department. We did a total of 1,156 vaccines to 611 children and 325 adults. And then we also did 794 flu shots. So keep in mind that during a period of 2020, the county buildings were closed and locked down. And we've been basically in a pandemic since the week of March 9th. So as we go through, our health department still got a lot done within the year. We did blood lead screenings on 31 children. We still dealt with 34 animal bites. We followed up on 6,139 reported communicable diseases. In an average year, we're usually about 188. So that one's pretty significant. We continue to do our health screenings in the schools to children. So 189 children received hearing screening. 21 children received scoliosis and 249 received vision. Those numbers are down because in this current school year that we're in, we basically were asked to come into the parochial schools, but our public schools visitation policies did not allow us to get in and do all of the screenings that we typically do within that public school setting. 64 TB skin tests were completed. Our WIC program still served 316 participants. We're still giving out the free well testing kits through our office. We were down this year on that, but 6 of those were given out. 65 Sharps containers were taken in through our Sharps disposal program. 328 individuals received blood pressure screening. We were unable to do most of our blood pressure clinics throughout the year. We still have not started that program back up, only because our meal sites are not up and running throughout the county, which is where most of that blood pressure screening takes place. These blood pressure screenings are done in our office on various people that come in and request it. And then we also see a large percentage of people through the behavioral health program that we do screenings on. 6 home visits were made to county residents for concerns on their properties, which means those are those human health hazard home visits that we make when we get those concerns. 328, oh, I'm sorry, the blood pressure is in there twice. I apologize for that. The back to school program continued last year. It was done under a different format, but we were able to serve 146 families and 343 children. And then we did do 230 foot care appointments through the Healthy Feet LLC contract that we have with our nurse, Lisa. When you flip over to page 7, you will see a financial look at where we were at throughout the year. And for the most part, when you go down the column, at least starting with maternal and child health and down, virtually all of our grant money was spent appropriately. So we did that as always. Public health general tax levy, which is at the top, we did not spend down completely simply because of all the grant funding that we received due to COVID throughout the year. And then the very bottom shows the preparedness COVID-19 grant. And it says that we spent $26,329. That grant actually carried over into 2021, and the remainder of that was spent by the end of March. And then the following was the COVID-19 CARES funding. That funding, we didn't receive in a lump fund that was funding that was reimbursed to us as we used it. So of the 275 that was available to us for testing, for planning, for contact tracing, we spent down 170,000 of that on those programs. And that was one that we had to give them an estimate at about maybe the end of October, beginning of November, what they thought we would spend down with our current needs. And then that money was taken back by the state and then redistributed through other programming that they did for COVID. So the rest of the annual report goes through program by program, gives you a brief description of each of those programs and just what we did throughout 2020 to try to meet the goals that we have set forth by the state for us. And I just invite you to read through and take a look, see what the health department actually did. Many health departments right now in the state have not resumed the majority of their programming. And I'm pretty proud of the fact that we continued to do as much as we could throughout 2020.
Any other questions on it? Yep. Which page?
Under COVID-19 in the second paragraph, our staff was, I think it should be was.
Okay. We can make that correction.
Just one other that has to do with baby. On page 10, under prenatal, the fourth line,
Mhm.
you're talking about delivering their baby. I think it should be babies because you're talking about women. And you'd have more than one baby.
Okay.
That's all I found.
All right.
Anybody else?
Okay.
Okay, then Cindy, we will move on to the April monthly report.
All right, so in front of you, you have your monthly report. Our WIC caseload contracted at 218 continues to serve roughly about, 210. We're at 211 this month, so that's gone up a little bit. So they're meeting their necessary caseload to continue their funding. Communicable disease wise, we were reported 433 diseases. 33 of those were confirmed, 19 probable and 2 suspect, many of which were COVID, although we're seeing a lot of our other diseases now return back into our caseload. With immunization, you can see that 1,884 shots were given. Those are COVID vaccines for the most part. We do still continue to do the childhood vaccines through our office as well as tetanus, but for the most part, those were COVID. And we had a couple of complaints that came through that we did some follow-up on, and I'll mention that in our agency updates in a bit. Deanne has been busy doing car seat installations, so those are listed there. And then I'm not sure, but if anyone has any questions in regard to the meetings, conferences, or activities, I'd be happy to answer them. All right.
You want to move then, Cindy, to the agency updates and the financial report we'll do together.
Okay, so for agency updates, I don't have a whole lot of new stuff for you, but I wanted to let you know that we are proceeding with summer school planning for 2 of our school districts. So we will be doing a babysitting course for the Kewaunee School District this summer. And we will also be doing a healthy cooking class for middle schoolers out of Algoma for sure. Kewaunee was looking for space, and I don't know if they've come up with that space or not, but that is out there for them as well. So we will be running a couple sessions of summer school. Our PALS program will be starting up in June. Kathy signed up. So that is our seniors exercise course that we tried to get up and running about a year ago and then got shut down because of COVID. Jessica will be leading that. And so that is scheduled to begin June 14th. We have a new summer intern that will be starting with us. His name is Jared. He is a public health, he's from UW Milwaukee, and his degree will be, he starts his master's program in public health in fall. And so he's going to do some work for us this summer on our community health improvement plan. So he's going to do a lot of the research that goes behind us before we present that to the community. So we're really happy to have him on. He's going to be spending about 8 to 10 weeks with our agency. Our Get Healthy Kewaunee County group has been busy. They are going to be doing a second round of bingo. I think if you watch Facebook at all, they had the first round was very successful. They had over 60 some people participate. They gave away a Packers jersey for the participation and things. So they're excited about having a second round of that starting shortly. They are going to work in conjunction with our intern, Jared, to do some restaurant surveying in the county. It was something that we wanted to do a year and a half ago to see if we can maybe have some healthier options put on some of the menus around the area. And then we're also going to be opening up for those trail walks again this summer. So last year we did it and it was a little bit less attended than we had hoped for, but we were in the middle of the pandemic and still had a lot of concerns at that point with the safer at home and things. But with our outside trail walks, we're going to use our county trails at Bremer and at Ryan Park. And then we use the Anopi and get people out and moving to help promote our trails as well. Our WIC department will be going through an annual evaluation that is going to happen on August 4th. They go through that every year or two, so that will be taking place as well this summer. Questions on anything that we're currently working on in the agency? All right, and then I did provide you with the March financial report. We're always a little bit behind because they come out just right after we have this meeting, but we're right on track with our spending. So we continue to spend on our grant dollars to the best of our ability. We are using very limited county tax dollars right now, as long as we can complete the programming that we need to do within the means that our grants put forth for us. Does anyone have any questions on the financials right now? Our COVID dollars are still coming out of that ELC CARES funding. That will continue through 2022 for us. So we have a fair amount of money available at that point. There's going to be a crossover this summer. I think at the end of May, beginning of June, we go from one pot of money to another that they are issuing.
So what does it look like then going forward for additional funding? Is there any discussion at the state level with funding being released for programs, certain things? I mean, we're getting through all the vaccinations. We've had enough vaccine, more vaccine than people willing to take it at this point. What's next?
It's a good question. They are discussing funding all the time. What they have told us is that this ELC funding, which will cover all of our epidemiology-based programming, so that's testing, that is contact tracing, that kind of thing isn't really going to go away, and they will continue to fund us through those things through November of 2022.
Because obviously there's a lot more that the health department does than just the virus.
Yep.
And there's a lot of other programs that are going to be needing funding and growing and expanding. So hopefully those discussions are still staying in the forefront.
They are. And I think what we're seeing right now is the funding that we are getting to do the COVID part of what we're doing is federal funding, but those state dollars are still there and we're still receiving them. So we continue to do those state funded programs to the best of our ability. They've all kind of made a little bit of an adjustment with the COVID thing going out there. But we do know that starting probably at January 1, 2022, we'll be returning to a lot of that original programming. And that funding, to my knowledge, has not changed.
Cindy, you're still planning on back to school program?
We are.
For August?
Yes, so we will be hosting the back to school program. I'm going to look at Deanne. August 11th is the date that it is set for down at Lake Haven Hall. It will probably happen more on the level of what we did last year, limiting the amount of people in the building at one time. But, you know, we were able to host an in-person event and I think it went very well. And so we made some adjustments that worked in our favor and I think we'll continue on that route.
Do you have enough people on your wait list to continue the vaccination clinics at the fairgrounds?
That's a great question. I'm going to say no. So we have probably 25 to 35 people on our Johnson & Johnson list and about 25 or so people on our Pfizer list that are waiting for vaccines. And it's not that we haven't offered it to them. It's that the date hasn't worked out for them or something like that has taken place. So I'm guessing that this is the last week that we will do first dose there. And then we'll continue through for 3 weeks. So I'm thinking about that maybe mid-June, we will vacate from the expo hall and move most of our services here. We're more than willing to go out on the road. So, you know, if we have a business that pops up or an entity that pops up and they want us to come in and vaccinate, we can certainly do that. But to take up the expo hall much longer than that for the smaller numbers that we're seeing, I think wouldn't be the wisest decision. So this is probably our last week, like I said, of offering that first dose there, and then we'll bring that back in-house.
I heard rumors and read things in the paper about 12-year-olds to 15-year-olds. Do you know anything about that?
Well, they haven't given us the definite go-ahead. I actually expected that to come out as a formal recommendation about a week ago, and it hasn't. Pfizer has been doing their trials on children, and they are fully expected to release that would be acceptable in the very near future. Pfizer has been doing trials all the way down to 6 months. So it's very possible that particular vaccine will expand their age range. I don't foresee that with either of the other two. At least not right now.
Have you heard anything? Will there have to be a third shot given?
It's really too soon to tell. So they're still studying the immunity that people are receiving from the vaccine is very strong. They're very happy with what is happening. They know that it is covering the main variants that are out in the community right now, but it's really hard to tell because the vaccine is too new and the virus is too new to tell how long that immunity will last. Anybody else? Okay.
Then at this point, we will go to travel request or approval.
We have none.
Overtime report.
We really don't have much of an overtime report right now either. Our vaccine clinics are slowing down. So for the most part, the girls have not been working overtime. And on the weekends, our coverage is coming from some of our contracted contact tracers. That's a tongue twister, just so you know. And so that is a straight rate that they receive for working the weekend. So we're not getting the overtime there as well.
Next meeting. Did you pencil anything? I did not read anything in you just didn't talk about it and I did not see it in the report. Okay. So June, normally we do the second weekend or second Monday. Is the 14th okay for everyone? Deanne, that'll be okay. So then June 14th, Monday, 8:30. That'll work. And if it doesn't work with vets, we'll have to change it then to a different one. I'll let you know. Okay, and then at this point, is there any other matters? I just want to say thank you to Linda for conducting the meeting last month. I appreciate it. Sorry for that little bit of short notice, but Thank you. All right, anything else? Otherwise, do I have a motion to adjourn? Jeff first, second by Kathy. All in favor, say aye.
Aye.
Oppose? This meeting is adjourned.